Hello, everyone. Our session today is organized in partnership with one of our US-QBC members, the DLA Piper Law Firm. In this webinar, we will explore considerations for safely reopening workplaces as countries begin to ease their lockdown restrictions. I would like to hand it over to Frank Ryan, DLA Piper's chairman-elect.
Thank you, everyone. I wish we were in person to see you today, but unfortunately, life's events don't allow that to take place. I hope that you and your families and loved ones are healthy and they are safe. I want to thank you for joining us today, and I want to thank the US-Qatar Business Council, all of our panelists, and for the attendees. It's very warm to know that many of our longtime friends and relationships we've had in Qatar are participating today. And I personally look forward to sharing a laugh and a meal together soon, God willing. Qatar is incredibly important to DLA Piper. We've had long-standing relationships there for many, many years. I've spent countless days and hours there, enjoying the country, meeting friends, working closely with clients, and I look forward to doing that again, hopefully soon. We value our partnership. Our law firm does. It's been long-standing, and we care deeply about the community. From a return to work perspective in the country, DLA Piper is in 35, 40 different countries. We've been dealing with this ourselves from a return to work perspective, and we'll be able to share some of what we've learned this morning with you. These are certainly challenging times. They're not easy. It's not easy doing business. It's tough on our employees. It's tough on our families. But we are hopefully today, the panel will help guide you through some of the very good learnings that have been developed by them and by others that they'll be sharing this morning. Our panel is very impressive. And so I guess the way to start is let's begin the conversation. I know I read that the Supreme Committee for Crisis Management issued a well-reasoned and comprehensive plan to lift the COVID-19 restrictions in Qatar. I'm sure that there'll be a lively discussion on this morning and other related topics. I want to thank you all again for participating this morning, and I'll now turn over the webinar to my partner, my dear friend, Joe Guarino, who's DLA's U.S. envoy to the Middle East. And thank you all for what you're doing today, and enjoy the seminar.
Thanks, Frank. So it goes without saying that the global COVID-19 pandemic has resulted in radical changes in the way companies and their employees work and operate. Almost overnight, nearly all companies around the world transitioned to a virtual operating environment, which for most included not only remote workers, but fundamental changes in workflows, business processes, sales, marketing motions, delivery support, compliance policies and procedures. Some companies and sectors thrived and more easily adapted to virtual operations than others. But all companies across all sectors were impacted. Driven largely by societal and economic pressure, nearly all domestic and foreign governments are planning a reopening. Those that don't may face economic or political or social backlash. However, the scope, timing, conditions, and requirements of reopenings remain fluid and somewhat consistent among jurisdictions. For one thing, the public health risk of COVID-19 is predicted by most public health professionals to be with us for an extended period of time, and I hope they're wrong. With that being said, allow me to introduce our panelists and then turn it over to Dr. Mohammed Elikad for a summary of the current state of medical affairs in Qatar. Donna, would you please introduce yourself?
Thank you, Joe. Good afternoon, everyone. I'm Dana Naimi, Deputy General Counsel at the Supreme Committee for Delivery and Legacy, the committee responsible for delivering the infrastructure and host country operations and planning for the 2022 FIFA World Cup. And I'm very excited to be part of this panel.
Sultan?
Thank you, Joe. Pleased to be part of this great panel. My name is Sultan Al Abdullah. I'm a practicing attorney. I have been for the past 21 years. My firm focuses on corporate and commercial work, corporate commercial clients, and I personally work mostly in litigation and arbitration.
Terrific. Thank you, Sultan, for being with us this morning, and Donna as well. Mark, would you please introduce yourself?
Thanks, Joe. Good afternoon, everybody. My name is Mark Proudley. I'm a director at Cushman & Wakefield, Qatar. We're part of an international real estate consultancy. I've been based here in Qatar since 2006, and I lead our commercial agency team, largely revolving around providing consultancy advice to both landlords and international occupier clients.
Terrific. Dr. Elakad, would you please introduce yourself, please?
Hi, I'm Mohammed Elakad. I'm the Vice Chair of Surgery in Hamad Medical Corporation. And I've been there for quite some time. And fortunate or unfortunate, when this started, I was a member of a SWIT committee, which is a system-wide committee for disasters, actually, of a command center.
Would you kindly give us your view of the current state of the healthcare crisis in Qatar, please?
Okay. Let me brief you all first about where we are and how did we reach there. I mean, we have been working hard on this since the first day it started in Qatar. We were lucky in a sense that we were not the first country to face it. We had a lot of countries faced it before. So we were able, once we started to recognize that the virus is there and some positive cases are there, we consulted almost everyone we know all over in Italy, in Asia, in Kuwait, and wherever countries that are ahead of us. So we gained some of their experience. Then we started a very strict plan that led to, we know the challenge was the rate of infection, the infection rate, and the capacity. It's demand and capacity issue. So we need to increase our capacity so much so we can accommodate the demand of COVID so we don't have any failure in the health system. This is what causes fear when you have very much demand over your capacity. By closing and by taking the precautions, we were able to this. If all of you went through the introduction of the Supreme Committee yesterday for opening the phases, they started with a slide I would like to start with too. It's not important to show you the slide, but what it says, if we didn't take any precautions and if we take the precautions, that it showed in red and the blue that we have 76% less cases if we didn't take any precautions. So by taking precautions, we minimize the curve. The curve did not get high, and then the decline is much faster. So there is a lot of measurements or a lot of KPIs, I said key performance indicators that you can look at, but instead of looking at pure numbers, which I'll tell you in few minutes or in 1 minute, the numbers we're having now, but mainly all the courses through, I can say that the most important thing is what we call it the R0, or the rate of infection, what we call it the death rate, and the test rate. So in Qatar, all through, we have a very high test rate. We're testing almost 80 every 1,000 of population. So to test 80 over 1,000 of population, this is very high. One of the highest countries that did testing for COVID. This, of course, will yield much more cases than if you are testing less. This is one factor. The second factor is the death rate. The death rate in Qatar remained till now is 0.1%, which is really good. If we compare it about 5% plus in the United States, in Europe, a lot of countries range it from 11% to 15%. We are here 0.1%. So then we call the rate of increase of cases. This is another measurement that we can measure. How much cases are increasing per day? What we were doing is increasing very gradually until we reach the peak, which we believe that we are now over it, or in the decline phase, started the decline phase. In the peak, we went up to 3.5% per day, a rate of increase, 3.5% per day. Now we are down to 2.6 to 2.7 per day. So the rate of infection or increase in infection detected cases are declining. This is in brief how do we look at it, and are we successful or not? Because we do believe that we have done a great job actually. We look at the numbers as of today. The total number of tested people is 200,065 tested already, and 500 something. The number of COVID positive patients under active treatment is about 25,000 under active treatment. Detected positive today is 1,700. Yesterday it was 14, today is 17. It's up and down, but it's still in much lower than at the peak. Number of ICU cases was 241, ranging about the 240. Then the recovered patient, which is an important figure, is 47,500 recovered. Which the number of deaths is for today 62. We have for new five deaths more today, and this is the largest number of deaths per day. We usually have 2 to 3. It was 4 at one time. Today is 5, and this is. Our expectations here in all the calculations that we passed already the peak. To look at how we are doing is that did we occupy all of our capacity available for COVID? Because the plan was to have COVID hospitals from the start, expand the capacity, expand the number of beds, and expand the ICU beds. The occupancy rate, no, we still have a lot of vacant places in hospital for COVID. I'm not talking about the whole hospital, but COVID hospitals confined for COVID hospitals, what we do. Still have a lot of capacity in the hospital, a lot of capacity in ICU. We're not yet consumed. That's what makes us feel safe, that we still have the capacity. What makes us feel safe too is the rate of infection rate is going down per day and is still having the lowest number of deaths till now, which is 0.1%. This is you on average or on brief what's all about. If you want any clarification, more clarification, I'm ready to do.
Thank you so much, Doctor. It's a privilege to have you on our panel this morning.
Thank you.
Thank you. Amanda, may we start the presentation?
Yep, give me just one sec.
Sure. Excellent. If we may go to the next slide. Well, welcome. Before we begin, the slides and recording will be circulated after the webinar broadcast. If you don't receive a copy, please feel free to email me. There's my email address. And any other questions you can ask our expert team of marketing folks who are also on this webinar. And I believe Caitlin's email address is listed here as well. You can go to the next slide, please. So today's agenda is somewhat aggressive, and we promise to get through it and leave time for questions and answers. We will be addressing planning the return to the workplace. We will be addressing preparing the workplace, preparing the workforce, mitigating litigation risk. I know that many of our clients are on this call, and that's something that they're always interested in. It will leave time for questions and answers. And at the end, we'll do a very short wrap up. At this point, I am going to turn it over to my dear friend. Oh, I would be remiss if I did not give credit to my dear friend, Salman Al-Ansari, who had a last minute client emergency and was unable to join our panel. He was also a panelist, but his legal brilliance and magic are sprinkled throughout this presentation. So thank you, Salman. So let's go to the next slide, please. And I will turn it over to my dear friend, Sultan, for a discussion on planning the return to work.
Qatar had, oh, sorry. I thought I was on. Okay. Well, thank you. As most of you are aware, Qatar has started to ease certain restrictions relating to economic activities by announcing yesterday that it will implement a 4-phase easing plan of all COVID-19 precautionary restrictions. The first phase begins next Monday and will permit, among other things, all operational businesses to have 20% of their staff present in the workplace. However, before returning to work, it's imperative that businesses are prepared to facilitate daily operations in the new COVID-19 business environment by appraising themselves of the latest government decisions and guidance. The primary authorities issuing decisions and guidance regarding the COVID-19 situation consist of the Supreme Committee for Crisis Management, the Ministry of Public Health, Ministry of Commerce, and the Ministry of Labor. Also, every Wednesday, the Council of Ministers meets, and there are usually decisions issued. There are usually decisions issued relating to COVID-19 precautionary measures. So information regarding the current status of these precautionary measures can be found on the websites of any of these authorities. And of course, local news publications are also a good source for finding latest decisions and guidance. Once armed with this knowledge, businesses can start to consider other key issues. To date, many COVID-19 measures remain in place, including the limitation on the number of staff permitted to attend the workplace. As one would imagine, this creates staffing issues, particularly where a company has multiple departments that all have individual staffing needs, which means that companies have to put into place a policy in which staff attendance is based on need, subject to certain criteria, perhaps by introducing departmental staffing rotations on a need basis. It is also important to ensure employee safety. There is no point in returning to work only to suffer a COVID-19 outbreak in the workplace. So businesses should have in place measures to ensure workplace safety, including mandatory mask wearing, face mask that is, temperature checks, social distancing, and similar precautions. In all likelihood, existing policies will need to be updated and amended to reflect the new reality of working in a COVID-19 environment. And once updated, these measures and policies should be clearly communicated to employees to ensure that they are understood and that the safety expectations are met upon returning to work. For those businesses that operate by committees or boards, it is likely will be necessary to implement new processes for attending meetings and voting. The composition of these bodies may also require some form of review. So as I mentioned, new policies have been adopted to return to work of businesses, but even where 100% of the workforce is permitted to return to work, it may be advisable to maintain a phased policy in this regard. Given the current circumstances, employers also should remain flexible and open to alternative working arrangements for certain employees, particularly high-risk employees, older staff, or staff with permanent health problems. Finally, even though restrictions are being lifted gradually, this does not mean that the COVID-19 threat is over. Businesses should revisit their business continuity plans and remote working policies in the event that another wave of infections occurs or some other unforeseen event happens. With that, I'll hand it back to you, Joe.
Thank you so much. Thank you so much, Sultan. Amanda, if we can go to the next slide, please. Preparing the workplace. I am going to now turn it over to my good friend, Mark Proudly from Cushman & Wakefield. Mark?
Thanks, Joe. I think we can all agree that the last few months have been unprecedented, really, in our lifetimes. Returning to the workplace will potentially be unpredictable and a stressful event for some employees who've adapted, in some cases, become accustomed to working from home. Personally, I'm looking forward to getting back to the office at some point. To address this, Cushman & Wakefield's international team have developed the Recovery Readiness document, a publication and how-to guide for reopening your workplace. I think hopefully we will try some tech wizardry to try and share that, a link for that in our chat box, but otherwise it can be downloaded from the Cushman & Wakefield website. The guide has been developed primarily on the back of Cushman's experiences of operating in Asia, where we've already assisted over 10,000 companies with 1 million employees to return to the workplace in some capacity. It's also been developed in partnership with public health organisations and international health and safety experts. The guide's intended to assist companies to provide employees with a sense of safety and security upon their return to the workplace through a combination of strategic and practical guidelines, and to help develop protocols and best practice. The guide's based upon the SAFE 6 principles: prepare the building, prepare the workforce, control access, create a social distancing plan, reduce touch points and increase cleaning, and communicate for confidence. As I mentioned, for those of you who are interested in some light bedtime reading, it's a pretty comprehensive document, and it can be made available and downloaded through our website.
Mark, it's Joe. Mark, it's Joe. If you wouldn't mind asking Amanda to switch the slides as you go through your presentation.
Oh, yeah, sure, will do, yeah.
Thank you, sir.
So I think that we're okay at the moment, but basically, I just wanted to talk through some of the key points for consideration for both landlords who will need to effectively prepare their assets, and also for the return of the building occupants, and for employers to ensure that they are ready to receive the workforce and that their employees are also prepared. These parties will be faced with many of the same challenges, and this is a unique opportunity for owners and occupiers to collaborate on their plans. The plans will look slightly different according to different employees and different business sectors. For example, the return to work for an organisation such as a government entity or a law firm, which typically occupy space with a number of private offices on a lower density basis, will look very different to a call centre operation, which has a high density occupation in an open plan arrangement. Likewise, plans for smaller employees in multi-tenanted buildings will look different to large companies and space users who have their own self-contained buildings. As Sultan mentioned, local regulations are a key driver in this process. And following the government announcement made yesterday for the phased lifting of the lockdown in Qatar, employers will need to start planning now. From the 1st of July, the rate of employees will be permitted to increase from 20% to 50% that are allowed into the workplace. That will increase to 80% from the 1st of August, returning to 100% from the 1st of September. The first question for employers to think about is who needs to be in the office. Employers will need to calculate the number of employees expected to return to the office under these different phases so they can plan accordingly. A vital question is, will working practices change more permanently? To be honest, we could probably create a whole webinar around that topic alone, but given the limited time, there are two key points that I wanted to make based on data that Cushman has been collating internationally from our occupier clients. The first of these is that working from home has generally been much more successful than anticipated by most companies. And the second point is that the feedback that we're receiving from a lot of these clients is that they're not seeking to rush their employees back to the office. In my opinion, it's too early to accurately forecast the long-term impact of COVID-19 on the office space, but I do believe that we will see more flexible working practices going forward. The design of office space will most probably be adapted in the future to become a place for meetings and collaboration, and less about sitting in solitude churning out work from a private desk. Based on my experiences of working in Qatar over the last 14 years, I believe that some of these trends may not develop as quickly locally for a number of reasons, including local culture and the relative ease of commuting into work in Doha, with most people driving to their office in their own private car. However, we are currently engaged by an international company operating in the IT sector to acquire office space for them in Doha. After several months of working on the project, they've decided that to reduce their requirement for office space by 30% over the last few weeks, as they've recognised that certain employees can successfully work from home the majority of the time. Most of you have probably realised by now that real estate consultants are not rocket scientists, and therefore a lot of the advice included in the Recovery Readiness Report is largely based on what I would call simple common sense. Building owners and employers will need to ensure the building is ready for occupation by adopting the following steps: ensuring compliance with local regulations, cleaning and preparing air conditioning systems to maximise fresh air, ensuring building rules and regulations are simple and easy to follow, controlling entry points into the building and creating separate entrances for deliveries, leveraging technology such as thermal imaging to monitor temperature of people entering the building, and automating building systems to minimise the requirement to touch surfaces. Certain areas of buildings may need to be reconfigured where gatherings take place, such as lobbies, and lift access will need to be controlled. We've also seen in some buildings installing plexiglass shields where appropriate, and disabling unused touch screens, and making PPE and hand sanitizers available as appropriate within the building. Employers and building owners will also need to consider implementing social distancing plans. This may require decreasing occupational density, though the latest government guidelines propose no more than 1 employee per 9 square meters of space, which to the best of our knowledge, most companies in Qatar already meet. Tools available to implement social distancing plans can include monitoring the use of workspace, managing employees with schedules that are staggered for different working times in the office, reconfiguring desks and seating arrangements, or installing shields or physical barriers between desks, reducing capacity in meeting rooms by removal of certain chairs, and prohibiting use of small shared spaces or managing access to them. It's important to have clear directional signage or markers on the floor, like many of you will have seen in supermarkets, to remind employees of social distancing. Our office is located in Tornado Tower, and I've already seen a number of these measures adopted, with stickers on the floor in the lifts showing people where to stand and minimising the number of people who should enter the lift at any one time. Walkways and corridors may need to be modified with directional signage to create a one-way traffic flow system around buildings where appropriate. In our Amsterdam office, Cushman's have constructed a prototype 6-feet office to test out some of these social distancing protocols. And again, for those who are interested, further details are available on our international website. Cleaning has historically been considered as a back-of-house operation, usually conducted in the evening after most employees have left for the day. We expect this to change and become a highly visible part of any building owner or employee's operations, promote confidence amongst visitors to buildings and employees. Cleaners should be professionally trained to ensure cleaning is being conducted to a high standard and in an appropriate manner. Again, modern technology can be adopted by tenants and incorporated into office space to minimize surfaces that need to be touched by automating elements such as lighting, doors opening, and sharing of office equipment. Employers will need to make sure that adequate supplies of PPE, such as face masks, are available, along with hand sanitizers and disinfectant wipes for employees to wipe down their equipment and desk space each day. And as I'm sure you're all aware, companies will need to plan this in advance, given the shortage of supplies in some of these sectors, generally globally. Policies on shared areas such as meeting rooms, kitchenettes, and bathroom access will also need to be developed, and hand sanitizer should be made available at both the entrance and the exit of bathrooms. And on a final note, as Sultan again has already mentioned, it's vital that employers communicate building rules and their plans to employees in advance to give them confidence when returning to work, and that rules and regulations are clear and easy to follow.
Mark, it's Joe. Mark.
Sorry.
Mark, it's Joe. What do you think the lead time is for employers in terms of communicating with landlords and other entities before they begin the process of bringing folks back to work?
I think, realistically, this has all been rolled out relatively quickly in areas where we've experienced it in Asia because of the rapidly developing situation.
Yeah.
I mean, obviously, ideally, you'd have a longer period of time, but I think these can be rolled out within 2 to 3 weeks potentially. And that's why employers need to be looking at that now, given the new regulations that will come into force from the end of this month, basically.
Yeah. Okay.
Okay, I'm going to hand back to you, Joe. I'm done. So thank you very much.
Oh, okay, Amanda.
At the end.
Thanks, Mark. Amanda, maybe go to the next slide. Preparing the workforce, and we have Donna Al-Naomi from the Deputy General Counsel of the Supreme Committee. Donna, would you tell us what your experience is and what the Supreme Committee is doing to prepare for
sure.
folks to come back to work?
Sure. Yeah. Thank you, Joe. I think, at the starting point, it's important to mention that the Supreme Committee has been proactive since the very early days of the pandemic, even with 0 cases being reported. We were communicating regularly with employees and workers about the virus, sharing hygiene practices, preventative measures, providing government-issued information, and posters around the office. We've also set up an internal coronavirus preparedness group to ensure constant engagement and communication with employees to prevent cases in the office and to ensure alignment with government guidelines and policies. Additionally, extensive impact assessments have been conducted across the organization, across all the functions, to understand in more detail the activity areas that would be most and least affected by this crisis. So this has enabled us to plan for the working remotely. And having said that, while most of us have been working remotely and are successful at doing that, we do have the additional challenge of construction continuing through the crisis, as it is on construction sites across Qatar and around the world. However, our robust workers' welfare response measures have mitigated the impact on our sites. So, like, for example, at-risk workers that are workers above 55 years or workers with chronic diseases, those were temporarily demobilized from site to safe environments due to them being more vulnerable to COVID-19. Additionally, in addition to our workers' welfare standards, we do ensure alignment with the national response strategy. So our response has also been guided by the preventative measures and guidelines that have been recommended by the Ministry of Public Health. And of course, the same applies for many industries in Qatar. Now, moving on to my next point, and as the country starts to lift restrictions, this takes us to the question of how and when do we start to open? And to address this question and to strategize and plan for a safe and healthy return to the office, the SC has set up a task force to look at how we can adapt the workplace to ensure people are kept safe and healthy. And we've also been working with world-class external training providers to offer tailored e-learning solutions to support that return phase. And then moving on to preparing the workplace, it's important to note that SC has already implemented a number of measures in the workplace, such as distributing masks and sanitizers at SC offices and SC project sites, testing the temperatures of employees and workers on site, establishing isolation rooms in the SC offices and work sites, and also implementing disinfection protocols and inspections to identify if all hygiene requirements are met. We've also implemented measures to prohibit non-essential visitors to SC construction sites, with only essential visits being allowed to both the office and the construction site. And these measures will remain in place for the time being, but we hope to be able to welcome an increasing number of employees back in due course. And of course, this again will be aligned with the government issued guidance. So in terms of preparing the workforce, so the most important thing in SC is that the frequency and quality of communication with staff has been consistently high, and this has taken place through emails, social media, the website, or by distributing posters around the sites, and that will continue to take place. We've also prioritized staff mental well-being and health by launching an internal hotline to support employees for them to share their concerns or queries or ask any questions. We've also set up an email account for coronavirus. So it's a coronavirus preparedness email account. And that's where employees can email us and ask any questions or raise any additional concerns they have. We've also, we're offering tips to employees on good ergonomics while working remotely. And of course, we're using the internal comms platform that we have to ensure that we have ongoing employee engagement and we maintain a high morale while in isolation or lockdown. And that's it for me, Joe.
Thank you so much. That was fantastic. Thanks for sharing all that with us.
Thank you.
Amanda, the next slide, if you would, please. Mitigating litigation risk. We are turning the presentation back to Sultan.
Thank you very much, Joe. There are obviously many legal issues associated with returning to work, and I would like to quickly go over some of them. And I'll split my discussion into three parts, if I may. First, the mandatory measures employers and employees must observe. Second, the potential criminal liability of employers and employees. And third, what employers can and cannot do under the labor law. So on the first point, the mandatory measures, the first thing to know is wearing face masks is obviously mandatory for all citizens and residents leaving their homes for any reason. The second is reducing the number of employees working in private sector companies to 20%. This is the requirement now until July 1, where this number goes to 50%. August 1, it goes to 80%. And then by September, 100% of employees can come back to work. Third, the employee meetings for public and private sector entities to be held remotely using electronic means, although a certain number of gatherings have been allowed by the measures that were announced last night. Fourth, the number of passengers on buses, work buses, has to be reduced to half capacity. And as we speak today, offices are not permitted on Fridays. Office work is not permitted on Fridays and Saturdays. So only 5 days a week. There are certain groups of companies that are exempt from some of these requirements, but those are generally the main requirements. So on the second point of discussion regarding the potential criminal liability, the first thing to say is that there has been an amendment to the provisions of the law on infectious diseases that was issued last March. This law basically places a positive obligation on certain categories of people to report an infectious disease, including, for that matter, COVID-19. And if a person fails to do that, then they are obviously punished. So under Article 3, if a person is diagnosed with or is suspected of having an infectious disease like COVID-19, the nearest medical center or hospital must be notified immediately, and that the medical center or hospital must promptly inform the Department of Preventive Health and then the Ministry of Health. And among the individuals and entities that must report cases of infectious diseases are doctors, the infected person themselves or their guardian, the employers in a number of situations. So the infected person's manager or employer is, once they sign into the workplace, has an obligation, a positive obligation to report that a person has a disease or suspected of having a disease. Now, there are monitoring mechanisms that have been put in place and are already implemented. First, the Qatari police and other services with appropriate jurisdiction are enforcing this law and other applicable laws. So there are patrol squads with authority to detain violators. Many people who drive through Doha would have seen checkpoints across many of the streets. And thirdly, there are hotlines that have been operated to receive reports and complaints related to any violations. Additionally, the Ministry of Interior launched a smartphone application called Ihtiraz, which Qatar citizens and residents are required to download on their phones as of May 22nd. So Ihtiraz, in theory at least, will assist in identifying disease transmission chains and alerting individuals and stakeholders to expedite the provision of medical support and prioritize testing. So what the amendment to the law provides that violators are punished and punished severely by up to 3 years imprisonment and or up to I think 200,000, I beg your pardon, riyals for violating this law. So employers and employees should be aware of this requirement. Turning now to the labor law issues. So as businesses return to work, concerns regarding the likelihood of employment-related litigation are foremost in employers' minds. Even though businesses are functioning again, the current circumstances change what we previously perceived to be the norm. And obviously, employers are struggling with staffing and other employment issues um, that they would probably not have encountered prior to the COVID-19 outbreak. So it seems that some employers mistakenly think that under the current circumstances, they can unilaterally impose changes to the employment relationship in order to suit the need of the business. This is not only incorrect, but implementing certain changes without the employee's input is almost guaranteed to lead to some form of litigation. For example, the employer is permitted to determine the date for an employee's annual leave, but the leave period may only be divided into no more than 2 periods and only with the consent of the employee. Also, decisions regarding mandatory unpaid leave, I think in your part of the world it's called furloughing, should not be made unilaterally by the employer. And even where an employee's consent is sought, no proposal should be put forward suggesting that termination of services may be the outcome for an employee who does not accept any leave without pay proposal by the employer. So an application should be made of the employee's own volition, as opposed to being formally asked by the employer to do so. Also problematic are salary reductions, even if the employee agrees to them. The reason is that according to the wage protection system found in Article 66 of the labor law, an employer is required to deposit each month into the bank account of the employee their full salary. In the event of a later dispute between the employee, it could provide proof that their full salary was not paid during this period, and that any agreement with the employer to reduce the salary was made under duress, potentially exposing the employer to fines and other penalties. On the plus side, an employer is permitted generally to determine staff rotations without having to seek consent of the employee. If the employer elects to lay off an employee, it's crucial that the employer do so according to the labor law and the specific terms of the employment contract. This includes observing all relevant notice periods or making payments in lieu of the notice period. Additionally, all end of service entitlements and payments for unused leave must be paid in accordance with the labor law, unless the employee is laid off for an Article 61 violation. Finally, it's important to have the employee sign a settlement and a release statement, making clear that all entitlements have been paid to the employee and no future claims exist against the company. Therefore, noting what I've said, I recommend that not acting unilaterally, for employers not to act unilaterally, and if necessary, making the minimum bilateral modifications to the existing employment relationships. Back to you, Joe.
Unmute. Thank you, Sultan. I was muted. I apologize. Sultan, I have a question for you. What would be your recommendation? Because this comes up in the U.S. all the time, and when I'm speaking to clients. What happens when employees say that they're not ready to come back to work, that they have anxiety about going back to a physical building? what would your counsel be to our friends and clients on this webinar this morning?
An employee who's not willing to go back to work can always ask for a leave.
Well, they're asking for some type of accommodation because they're concerned that there isn't a vaccine. They're concerned that that they may get sick. Whatever their concerns may be, it comes up in my practice all the time. I'm just curious as to what your counsel would be under Qatari law.
Yeah, there is more than one form of leave. So there is the regular leave, the annual leave, if you like, and there is the unpaid leave, which they can ask for, or they can get a medical leave and or a sick leave. And a sick leave requires obviously some certification of from a medical practitioner. If they do not want to go all through any of those forms of leave, then I think my counsel would be to assess whether that individual is important to the business and the company. If they are, then obviously the employer will have to take a view on whether to retain their services. If they are not essential for the business and can be replaced, then my counsel would be to kiss them goodbye.
Thank you so much. Okay, we have moved into the Q&A portion of the program. I believe we're taking questions online here. And let's see. There's a question for Sultan. Did you say that employers cannot fire employees or reduce their salary? Is that correct?
What I've said is that if they are contemplating, an employer is contemplating to reduce the salary of an employee,
yes,
they should not make it in a way where they insinuate that if an employee refuses a salary reduction, then they will be fired, because that exposes an employer to liability, civil liability. What they should do is discuss with the employee a reduction in salary. If they are not willing to accept, then they take a view on whether to keep them or to get rid of them.
Understood, understood. Another question for the group is, is the plan that came out last night by the Supreme Committee for Crisis Management, does that apply to both private and public sector employers?
Do you want me to respond
yes,
to
please.
that?
Yes.
Well, it is a national plan in the sense that it applies to across the board, across the spectrum, and it covers almost all types of businesses and outlets, business outlets. So in my view, I think although, by the way, it is structured, it seems to apply more to private practice. I think the public sector, the government services will follow the same type of, the same plan. So it's a national plan in that sense.
Understood, understood. Thank you so much. We have a question, and this may be from Mark. Mark, did you have a chance to review the SCCM plan last night or this morning?
Yes, I did see it, yeah.
Yeah, can you repeat for the benefit of our attendees the dates of the different phases of the progressive increase, if you recall?
The current regulations that are in place at the moment are that you are permitted to have 20% of the workforce in the office, or you shouldn't be at any more than 20% in the office at the moment. From the 1st of July, that is due to increase to 50%. And then from the 1st of August up to 8th in September, it returns to 100%. Now, I think one point I'll just make, and I think Dana mentioned this as well when she was speaking, that doesn't necessarily mean that you will automatically rush everybody back into the office.
Yeah.
You know, companies will do it differently. And And based on experiences and stories that I've heard in other places in the world, even though, you know, in certain cities that they are back up to capacity, that it hasn't happened like that or as quickly. You know, people are generally afraid a little bit, I think, but I would stress that in some of these cities, I think they have unique situations in terms of, so for example, if I worked in London, I think my primary concern would be commuting on the London Underground or something into my office versus actually being based in the office potentially. So, you know, every will be different, and but it does, those are the regulations, but that doesn't mean that everybody will rush back to the office.
Understood, understood. We have time for one or two more questions. Let's see what we have here. For Sultan, what would, if an employee is forced to take a paid or unpaid vacation, but signed the necessary paperwork, can they later claim that they were forced to sign the paperwork? Understand that question? Yeah.
You seem to say if an employee is forced.
Yeah.
I think that's not a good start. Employees should not.
I think persuaded would have been a better word. Yeah.
Yes, I think so. But so you really have to persuade them. And if this does go to a labor law court or panel, to an employment panel, employment disputes panel, then it's possible that an employee can say that they have not signed this document or the request voluntarily, which will open up, you know, a discussion on what evidence they have to show that they were forced to sign whatever document they were asked to sign.
It's always a fact-sensitive inquiry. Yeah, it's always a fact-sensitive inquiry when those allegations are made. Here's a question for the group, and we talk about this a lot, not only at DLA Piper, but when I'm on calls with my clients' boards, when I'm speaking to general counsels of multi-jurisdictional and global type of clients. What's the opinion of this panel as to whether or not telecommuting becomes part of life from this day forward?
What commuting is that?
Telecommuting, working from home.
Oh, okay. Sorry.
Do you want me to?
Yeah, Mark, Dr. Ellicott, please join in. Yeah.
I think, as I mentioned during my sort of presentation, I think my feeling is that going forward, you know, people have experienced home working and will want greater flexibility going forward to work from home.
Yeah.
But that's to say that there won't be a role for the office for people to go to, you know, but people will adopt using technology. And that's very much the feedback we've had from our international clients. As I mentioned, that you know, they've actually found working from home has generally worked very well for most of them, or much better than they anticipated. And I think, you know, there will be an adaptation going forward on that. Just to add a sort of more local context briefly, you know, my experiences of working in Qatar have been, having worked in London previously, when I came to Qatar, what I found is that people are much more wanted to have face-to-face meetings rather than necessarily speaking on the telephone. And I think that's an important part of the local culture, and that will continue to some extent. And therefore, I think that will be important, and people will still go to the office and go to meet people face.
Very, very, very eloquently stated, sir. And I think you're right. What I found personally is that I like working from home. I don't like the noise that goes on in this house all day, but I can't control that. I have little children and a family, which is not conducive to deep legal thinking at times, but you learn how to adapt. I enjoy that flexibility as well. I think the folks that work with me also enjoy it. And what I found is that productivity has increased. People seemed happier, kind of less stressed out with the commute and with, with raising a family and having a high pressure job. I think it's here to stay. And I think that it's the next chapter, and I think it's a to be determined as to how this all plays out once, with God's grace, the healthcare crisis comes to a conclusion. That's the end of our program. Amanda, would you go to the last slide, please, if you wouldn't mind? Amanda? Hi. Gone through the question and the answers. Thank you. So a little bit of self-promotion. We have a Coronis, DLA Piper, my law firm, has a coronavirus resource center that you can access through clicking on this link. And I believe Amanda is going to send out the slides at the conclusion of the presentation. In addition, our teams overseas this morning have updated our website to include the SCCM's latest guidance and plan. And so you're more than welcome to visit our website and to download or review anything you'd like. We also have something called Genie. Next, Amanda, please. Genie is a great resource. It's something that, I represent a lot of clients that have global workforces. It's something that clients always ask me, Joe, why are you giving this away for free? It's that good. If you would like a subscription to Genie, please email me. I'll be glad to connect you and get you credentials. It is usually the first step that our global clients go to when they have a question in a jurisdiction in which they're not familiar with. It's updated on a regular basis. It's reliable, and it's something that's an incredible value add to being part of the DLA Piper family. So in conclusion, I hope everyone found this webinar informative. I wish everyone continued health, happiness, and peace. I cannot wait to see you again soon, my panelists and my friends on the webinar, to take a walk on the Corniche or a run on the Corniche, to walk through the souk. These are all the things that I love, that I really miss about Doha. It's an incredibly magical place. And I am very grateful for allowing for the US-Qatar Business Council to team up with us and to allow such an esteemed panel of friends and colleagues to present to you on that, I think, is a very important and timely issue. Mace?
Well, I want to thank all our panelists and for everybody who's joined us today. We really hope you were able to get some guidance from this session as we work together in opening gradually over the next new phases. God bless and stay safe, everyone. Thank you again.
Inshallah. Thank you.
Thank you.
Thank you.